Gillian Cook talking in the Timeless Taupo studios and Joan Williamson-Orr, and the subject being bringing communities together to better the ownership of the equipment and health services in the Taupo district. In 1992, Friends of the Hospital was formed, and in the early 2000s, that name changed to Taupo Hospital and Health Society. Now, Joan is a member of that incorporation, and since the formation in 1992, I believe $1.3 million has been raised.
That's correct.
That's a huge amount of money. Good day to you, Joan.
Good day to you, Gillian, as well.
Thank you for coming in. Now, we're at a stage where there's a one-off fundraiser is happening, and that's to do with the new hospital, and keeping with the theme of what the society was formed for, which was to get hospital equipment and keep it in the ownership of the community.
That's right.
This is still in the same line, the $400,000 required?
Yes, it is. The Lakes District Health Board, of course, provide the building, and the principle of the Taupo Hospital and Health Society is to improve services for our community, both within the hospital and out in the community for services. That's why we changed the name to the Hospital and Health Society, because I think of a lot of us, our goal is to keep out of hospital if we can, but inevitably we do have to go to hospital, most of us, at some stage. And certainly for some of our ageing population, that happens more frequently. And that means that we need to have the services, the equipment. Services are wonderful up there, there's no doubt about that, but we need to have the best fit out, the best facilities that we can have. And because of such things as the Christchurch earthquake, for example, there's a lot of money, and we all know that, and we sympathise and we recognise that has had to go into Christchurch. And it's also meant that the cost of our upgrade has been greater because there's had to be greater earthquake requirements now. Seismic activities had to be researched, and we've had to put extra strength into the building, and that's all cost money. So it's left the hospital
with less funds for the equipment.
Yeah, that's right.
Okay.
So
the community's stepping up. The community is stepping up.
It really is, because the Hospital and Health Society, well, years ago had 1,100 members, and it is the community. It's owned by the community. It is for the community. And now we are going to say to our community, hey, this hospital is our hospital. We need to have the improvements. And so there's one more drive now to get this $400,000. And this is for the wider community. It's Turangi as well, and Mangakino, and the area all around, farming area, as well as the Taupo district's area, our township. So this is something, and if everybody gave, say, $20 a head or something like that, more or less, whatever you can afford, we would achieve our target.
How often would Taupo Hospital and Health Society be asked by a community group, why should we put money toward this?
Yes, we do get asked that. The people say, why doesn't the government fund it? Well, I mean, we all are the government, aren't we? You know, whether we pay with taxes or through special fundraising like this one. But as I've said, the whole cost has risen, and health boards, I know we say, oh, well, you know, they should do it, but I've been on that health board. I was deputy chair for quite a number of years, and our Lakes District Health Board actually has squeezed more out of the Ministry of Health than a lot of others, because we've had such good results both in Rotorua and here. And you've got to remember they've also put millions and millions into the new hospital rebuild in Rotorua, which we benefit from as well. But we want as many services here as we can have. And if we help with this upgrade, we will get the services here. We won't have to travel so much.
Exactly. Well, let's hear more about the actual groups that have been helping out and what more can be done after this next song.
Yes.
Timeless Taupo, Gillian with Joan Williamson-Orr, talking about the funds being raised for the equipment in the new hospital. So there's been a one-off fundraiser, and big thanks to lots of people, huh, Joan?
Oh, my word. Individuals, of course, too, but look, it's like you folk here, Timeless Taupo. you're giving your time for free to support us, and I don't know how we could put a value on the support we're getting from many of the groups, the Rotaries and the various organisations. And Turangi is just being wonderful. The groups down there are getting together and doing their bit, and I think it needs to remind us here in the larger area, the amount that we can do here, we can do it. There's no question about it. And I know there are lots of organisations that are needing funds, but this one is one that it's I see it as very much a total community-owned thing. It's nothing specific in the way that it's for a particular issue. It's for all of us, for our health.
Yes, we all need health services at some stage or another, don't we?
Well, we do.
No matter what age we are.
It may be one of the other services in the community that do get support from the Hospital and Health Society.
I've got a list here of a few of the places, at the risk of leaving anybody out, but of course we're wanting to get more people on board here.
Yes.
Taupo Quilters Club, they're putting together a lovely quilt that's going to be raffled.
Aren't they wonderful?
Paitiki Lions have given $8,000. Waiora House, $5,000. Rotary is an ongoing type of fundraising things. There's Turangi Lions, Turangi Women's Club, Probus Club, and others. Like I say, there could be others that I haven't named. Yeah. So we are talking a huge community coming together here, aren't we?
Look, we are, and there are many clubs who don't actually fundraise. They're there for relaxation or entertainment or various things, and the policy is not to fundraise, but it's amazing how they, in their own way, are helping to promote it by having us speak there. We're having Eileen Caperton, who's this year the president of the society. And, of course, we've got Julie Eilers, who goes out there and explaining about the new facilities.
She's the CEO at the hospital.
She's a manager, yes, she is. And they're all doing their bit. They're all doing a great job because we're all so enthusiastic about doing this.
$400,000 is a lot of money.
It is a lot of money. Yes, it is. It is.
But like you say, for everybody in the district, 36,000 or thereabouts gave $20.
Well, you've got
it. Well, easily, even $10.
Yes, that's right.
Yes.
And of course, a lot more are able to give more, and a lot more are giving more.
Yes.
But it's through a lot of the organisations. The more organisations, because speaking to 50 people instead of one, that spreads like ripples in a pond, and they then make an individual choice to give support.
That's right. Now, the equipment is what sort of equipment? Is it mainly in the A&E?
It's right throughout the new development.
Like hoists and beds? And
yes, that's right.
Wheelchairs and things like that.
You've got it.
So the purpose of the community owning that equipment is for, ownership's sake? Or?
Well, certainly it is owned by our community. Everything that goes into the hospital and Health Society have provided, it is owned by our communities. It's for the sake of improved services to us all.
Okay, because otherwise that equipment wouldn't be there?
That's right.
So this is additional to what
to what is
required as such by the...
In a hospital of our size, yes.
Okay.
Yes, and certainly it enables specialists to come from Rotorua, Hamilton, wherever, because we have the facilities.
Right.
And so therefore we benefit from it in many ways. We benefit from it because of greater comfort for patients and visitors, and we benefit because it can attract the services and the people who provide those services.
So this goes right back to the 20-odd years that the society was formed, when it was Friends of the Hospital. Yep. The same ethos still goes for the equipment, to have better equipment so we can get the specialists here so people don't have to travel. So it is obviously for the community.
Oh, absolutely. And I have to give credit to the late Peter Goubelet, who right at the very beginning came to see me in my days when I was in that office and had this idea. And the talk was the hospital. There was a rumour the hospital was going to close.
What office are we talking, Joan?
We're talking about the Mayoral one.
When you
know
were,
jolly
when
well.
You were there, well, we must
that's
say.
Right, yeah. But that's irrelevant now. But in those, he did that. And then you had people like Joan Gardner and Les Winslade, and so, you've got to be very careful because you start missing names out. But these are people who have just worked tirelessly to get more members to provide these services and facilities up at our hospital and out in the community. I have to keep stressing that because there's a terrific lot has been done out with the various services, whether it's dental care, Alzheimer's or whatever. There's the support goes out from the hospital.
Right. Now, getting the community together and what they should do, let's have a talk about what people can do to help this cause after this next song.
Right.
Gillian Cook speaking with Joan Williamson-Orr about the Taupo Hospital and Health Society one-off fundraiser for community ownership of equipment and health services in the Taupo district. So $400,000 being raised. How can people help, Joan?
Contributing small or large amounts, and they can do that by internet banking, they can do it by a cheque, they can do it by just cash.
And there's this wonderful website called taupohospitalappeal.co.nz, and on there people can go to the section that says donate.
Right.
You make a donation, and it's really simple.
But it is, and remember it's tax deductible, which is helpful to people.
And there's a pamphlet also that's pretty readily available at Kean's Pharmacy.
Yes.
And other places you'll be distributing them.
Yeah, this is just the beginning of the campaign, and these very simple forms explaining what it's about and making it much easier for people to contribute, and they will be quite widely distributed in the very near future.
Now, the Taupo district is also going to be hearing about the concert that's been organised.
Yes.
So people can attend and enjoy that.
That's right.
Knowing that their money to watch this wonderful show is actually going toward the hospital equipment.
More about that very soon.
Yes, we'll keep people updated. And raffles for the quilts will also be available shortly, so we'll let you public know about that when that happens.
And we are trying to speak to as many groups as possible. I know Eileen Clapperton, the president now, she's doing that. So is Julie Eilers from the manager of the hospital. And there is a great deal of support and interest out there, but it's like anything that we all have to make that effort, and we only want to do this once, get it done, and then just absolutely take so much pleasure and pride in our hospital because the use of it is just so important.
And also getting involved, Timeless Taupo clients will be doing that, and others, like you say, can spread the word like wildfire around their networks as well.
Absolutely. I can't overstress how important it is that we succeed with this fundraising appeal.
Now, the appeal goes for only a few months, though, doesn't it?
Yes, we want it to be short, sharp and get it over with so we're not annoying people too much about it. I know we will achieve it. We've always achieved it with the Hospital Health Society when we've needed something for any specific thing. But this one is a biggie. And certainly, look, it's $5 to be a member annually and $100 for a life membership. We just encourage people to take ownership and become members and to take ownership of our Taupo District Hospital and Health Society.
And they can do that again by going into Kean's Pharmacy in Hugh Street.
Right.
Just along from Taupo Audiology.
Yep.
Pick up a pamphlet. It's easy peasy to fill it in and get it sent, or go online to the taupohospitalappeal.co.nz. Great.
Thank you, Gillian.
Well, let's enjoy some more music. We'll be hearing from some of your team members. They'll be coming in to speak to us about the updated, at the moment, $400,000 being raised for the equipment at the Taupo Hospital.
Yes, and we will keep everybody informed.
That's our lovely Joan Williamson-Orr speaking with us and telling us all about the Taupo Hospital and Health Society. Big one-off fundraiser of $400,000. So everybody get together and support so that we can have this great new equipment in the new hospital. This interview with Joan Williamson-Orr was broadcast twice in July 2013, creating a swell of support. About $400,000 is a high target for a small population of around 30,000 people in the Taupo district. So if you've got any ideas, or if you as an individual know of a group that you're associated with that would like to give financial support or any other support to the Taupo Hospital and Health Society, then follow their website. Go to taupohospitalappeal.co.nz. That's taupohospitalappeal.co.nz.